everyone. Today we're going to be talking a bit about fertility and the criteria under the NHS and how common this problem is. So let's start off with...
Sorry, it's really common. And I think every time you see somebody with fertility problems, it's always quite complicated. Mm-hmm. So it takes a lot for people to have to go to a GP and say, this is the problem I'm having at the moment. And then people often probably tried for a year at least, maybe more actually. But the thing is that the world we live in is really quite different now. For example, some certainly for our patients, lots of people might travel abroad, or they might do consultancy work, or they might, visit relatives in other countries or wherever. So actually, they're not even in the same geographical place, for long periods, and so that, and then sometimes people get a lot of pressure after they're married to...
Yeah, I was just going to say that, especially in the Asian culture, we have a lot of that, don't we? As soon as you get married, you need to have kids. Then once you have the first kid, you need to have the second kid, and then it just goes on from there.
And I think there's a little bit of humour and a little bit of jokes around that and stuff, but I think it is real, isn't it? Don't you think?
Yeah, definitely.
Because it starts off as a little bit of a joke, like where's my grandchild and all of this stuff. But actually, if that's the only conversation that you have, and it does, I think it affects...
It plays with someone's mind as well. If your mum or your dad say that to you, that's going to stay in your mind.
Yeah, and often your mum and your dad probably have your best interests at heart, but it's the aunts, the uncles, the extended family, that person has got a child, all of this kind of, as I say, I don't think it's a big...
Every situation is unique as well.
Yeah.
So everyone's in their own situation.
It's probably not as bad, perhaps, than say, 10 years ago or something, but it's slightly less sinister and less formal, but I think it is still there, that cultural...
you're talking about a bit of a taboo.
Yeah.
There's a bit of a taboo around it, but I think that's getting better.
I think it is.
We have a lot more patients coming to us saying, we're having problems with this. That's really good that they open up.
Yeah.
And it's because we see the husband and wife together. So it's like a joint process. It's not just one person going through that on their own.
But the slight problem with that, though, is that I find that what happens is that in relationships, it's very rarely one person's kind of that fertility is a problem because of one person. Yeah. Usually, it's a combination of factors, and life gets in the way and all the rest of it. But it's really hard. Say, for example, if you feel that it's your fault, or it's because of some medical condition you have, or wherever tests and stuff, there really isn't much you can say to that person. You can't say you can't say, oh well, it's fine, because then it's not fine, because that one person feels as though it's their fault that that the other person can't have children and stuff. And then the second thing is that if you say they're there, then don't worry, I completely understand. Then it feels like sympathy and stuff, and you don't really want that either.
Also, some people, they might be in denial, so they might either blame their partner or they blame other factors. And some people are in denial, that they've got this problem. So,
yeah.
But it's not something to be ashamed about. I think that's what we're trying to say, isn't it? There's help out there. There's different services that you can access.
There are a lot of services that are playing on people's kind of fears and as well. So I think you have to be careful as to who you go to and who you see. There there are miracle cures, and there are, perhaps some clinics which are over-promise and stuff, and I don't know. I think that personally, I think that it's things around fertility are quite a big industry, and I think the place to start is probably to see your GP and go through the NHS and stuff. So
talk a bit about the guide, like the criteria.
Yeah.
So we need to do, for example, blood tests. So most of these investigations have to be done on the woman. So like, for example, blood tests on like certain days of her period. And we'll come back to that. We'll talk about like irregular cycles. And then like, for example, she has to have an MMR vaccine, at least one dose. She has to have that. She has to have chlamydia urine checked. And also important is BMI should be between 20 and 30. So anything below or anything above that, the hospital just refuses to see. I know, because it's more difficult to get pregnant if you're, for example, underweight or overweight. So you have to be at a stable weight. So that's like one of the reasons. Just going back to the cycle, for a woman, we get a lot of patients who have like irregular cycles and stuff. So what would you say in terms of that?
Yeah, I think it is fertility investigations are people are going through a difficult time in their lives, and this is increasingly stressful. And I think, there's this idea that you have, progesterone blood tests done at different types of the cycle, early on in the pregnancy, early on in the cycle, in the middle of the cycle as well. So day 21. For a 28-day cycle. And that day may fall on a Sunday. It may fall on a day that you may be busy, or you may have things that, other things that are going on. So we just want to just kind of like, it doesn't have to be on exactly that day. So you got a bit.
Yeah, it can be like the day before, the day after. So they have that like a little bit of leeway.
Even a few days before and after.
Yeah.
And some people who don't have regular periods at all, then obviously if your cycle is changes from maybe 2 months, maybe you don't know where your middle of your cycle is, so we just kind of estimate it as long as the doctors have a bit of history, they can say, oh, fine, well, these are the different blood tests at different times. Can I just ask, actually, the referral criteria, because lots of people have different criteria for referrals, don't they? So what are they here in Northwest London?
So the blood test, like we said, day 2 to 4, day 8 and day 21 of the cycle for a woman, MMR vaccine, and also a lot of people, they don't know if they've had the MMR vaccine. So what we do a rubella blood test to check if they've been vaccinated or not. If they haven't been vaccinated, we give them at least one vaccine before we refer. Urine chlamydia, we check that, and BMI has to be between 20 and 30. And then for the man, he has to have his semen analysis done. He needs to have a smear test as well. So all of these investigations.
As long as they're over 25, isn't it? So because there isn't a lower age limit for fertility referral, although you have to have been trying for a year.
Yeah, there's the upper age limit, which is 42. 42, yeah. So up until 42, we can refer under the NHS. But then after that, we can't, unfortunately.
And the reason for the upper limit is because as one gets a bit older, then there's more likely to be complications because of the pregnancy and stuff. So there are, and even for the weight as well. And so it sometimes can be quite hard to tell patients that these are the criteria, but there is a reason behind those criteria. Yeah. And the idea is to kind of, to basically to increase your chances of getting pregnant in the first place, and for that to be a safe and healthy pregnancy.
Yeah, definitely.
So it can be really difficult when somebody's approaching 40 and they for, need to get all these tests done and need to have a referral. And so
I think that the biggest thing is just being open with patients, like having that open conversation, like being honest. So someone knows like where they kind of stand, what their expectations are, and what we can do for them, basically.
and also we work under the guidelines that are set.
Yeah.
We don't make those rules, but we understand the science behind those rules.
Yes.
And it kind of and our job is to try to make that process as smooth and efficient as possible.
Yeah, definitely.
And then also, and if you've had children, if you've had children before, does that mean that you can't have fertility treatment?
So you can't have more than one child in the relationship.
But if you've got a child or two children from a previous relationship,
yeah, that doesn't count. Yeah, that's fine as long as it's not in the current relationship. Otherwise, they'll just be like, we can't see you. Another thing is that we get a lot of overseas patients, so most of them have to pay if they go under the hospital for fertility treatment. So that's something to remember.
Well, that is interesting. Actually, could you explain that a bit?
So because of some people's visas, they're not entitled to treatment. So they're entitled to GP treatment, but not hospital treatment. So when you go under the hospital for fertility treatment, they have to pay for that, and it is quite expensive. So that's something to take into account before you kind of go through this whole process. And for some patients, like it's easier for them to just do it all privately because it might, for example, cost less and it might take be a lot quicker than it's under the NHS. So I think just educating yourselves before you're going into something like that.
That's a really useful point, actually, because
we get a lot of disappointed. Yeah, you can get a lot of disappointed patients.
One thing I find really hard to sort of try to explain, actually, is how, and I've seen this happen lots of times where, like sometimes people go for fertility treatment. So the fertility treatment is normally done in cycles. And so people might have 2 or 3 cycles for fertility, and then they are between cycles, so they're about to have another one, and then they don't get pregnant in the cycles, and then they do get pregnant between the cycles when they are not having any medication, any treatment, or anything at all. I wonder, it's always been, and that's happened so many times.
Yeah.
And I wonder if it's because people are, because the whole process is so stressful. Coming to, these are young, fit, healthy people coming to a GP surgery, coming to a hospital, taking time off work.
They don't want to be here.
No.
They want to be doing living their life or whatever.
Yeah.
They don't want to be here. So I think what you said, stress is a big factor.
Yeah, because the stress hormones are similar to the sex hormones. So actually, if you're really stressed, then it stops ovulation. So it or reduces ovulation. And then, then actually, and then imagine if you think, that cycle hasn't worked out. And you know what? I'm not going to think about it. And then actually things kind of come back, switch back into normal. But it's always like really hard, I think, for me when I speak to patients. It's I can't say, you don't know what they're going through as a couple. Say telling someone stop being stressed is going to not help matters. Yeah. So you just have to say, well, actually, like lots of other people have gone through what you're going through, and you're not alone. And I think we should maybe do some more sort of group stuff, maybe. But then I'm not sure, maybe people don't want to go to that.
A lot of the times, like, someone doesn't know that they're stressed.
Yeah.
It's not something that's, like, immediately apparent. I think you can see it in, like, other factors, like the way that, what food you eat, how your mood is, things like that. So, but like you said, you can't just stop stress. It's something else. It's a process, I guess.
And all the other stuff, actually, it's a good point about all the other bits and pieces that go into, when planning to get pregnant, because you could get pregnant any time. So, things like folic acid and diet and exercise and, trying to be mentally and physically well are important things to bear in mind as well.
Definitely. And it's like if a woman is pregnant and she's stressed, that affects the baby, right?
Yeah.
That's, yeah.
It's I have to say, it's funny because it's a really difficult time in people's lives.
Yeah.
And I think our job is just try to help them through and try to make it a pleasant experience as possible. But, there are always bound to be pressure points, like not being able to get an appointment that particular day at that particular time.
Yeah.
Having the, always like with things like semen analysis, there's always going to be like some mild abnormalities, which don't mean very much in the great scheme of things. But it's something that causes a burden makes men stressed as well. And they think, oh, well, it's my fault. It's all down to me.
That all factors into that. And I think another thing is that obviously with the NHS, you have to wait a couple of months at least for your first appointment. So that kind of just adds to that stress. But obviously, like with us, it's not something we can control, unfortunately. We can just like educate patients and tell them, you might have to wait this long. Just be honest, I think, about it. And then
actually, if you think about difficult things with referrals, maybe that's worth highlighting as well, because those things are out of our control, aren't they? So I think, is it right, if investigations have been done and it's taken more than 3 months, then they have to be done again. Is that right? Or...
Yeah, I believe so, yeah. So it's 6 months?
Yeah, 3 to 6 months.
3 to 6, yeah. If the investigations aren't in the last 3 to 6 months, they have to be repeated. So you kind of have to be ready to go to the hospital and start like treatment and things like that at that point. Otherwise, there's no point in doing the investigations.
Yeah.
You kind of just have to go through that again.
And that's quite hard as well.
Yeah. Stressful. Yeah. So what happens if the semen analysis is abnormal?
Semen analysis is very rarely completely normal. There are always likely to be minor issues. Normally the referrals are made to all the information around the investigations for women and for their partners is sent to in the referral to the fertility clinic under the female.
What was name?
Yeah. So that would be sent off as part of that bit of information. If there's a serious abnormality, like, for example, certain conditions like azoospermia, where there's just like no sperm at all, then you'd think about making a referral to andrology, which is a subsection of urology. But normally, the usual kind of borderline abnormalities, we would refer to the fertility clinic, and the fertility clinic would refer on to wherever that person needs to go. So as I say, it's normally not just, a male problem or a female problem. Normally it's
combination,
little bits of both, and then a bunch of stuff around the stress and work, and then, the environment, exercise, diet, being fit, healthy and stuff. So that's how it kind of pans out. So one thing worth mentioning is that actually at this point in time, people are, it's kind of quite a dark, difficult time. And the good thing about general practice is that you see this change over because you see people over a long period of time, and actually a lot of people who have had fertility issues, and it was so stressful and traumatic at the time. They go on to have babies and stuff, and there are lots of them, and then this is all forgotten, and but and actually there are other people who don't have babies, and actually it will pass. It just feels like it's and it will pass, and I think that the thing to do is to just look after yourself and each other. And it's really awkward because it's one of the few times when, even if you're in a close relationship, that there's nothing really that you can say to the other person, because that's when, if you say something nice, then they think, oh, they feel sorry for me. And if you say something horrible, they say, how could they say something horrible to me? So there's nothing that anyone can say. So it just, my top tips for fertility are: get all your bits and pieces, all your tests done as quickly as possible. Try not to be the only thing that you think about when you're, trying to have a baby. Just, as you say, live your life. And then try to work on your physical and mental well-being, and take things like folic acid, because you could get pregnant at any time. So, and it will pass. It's not going to be forever. So, your top tips? And it will pass. And I think that the thing to do is to just look after yourself and each other. And it's really awkward because it's one of the few times when, even if you're in a close relationship, that there's nothing really that you can say to the other person, because that's when, if you say something nice, then they think, oh, they feel sorry for me. And if you say something horrible, they say, how could they say something horrible to me? So there's nothing that anyone can say. So it just kind of, my top tip is, and it's desperately patronizing, but my top tips for fertility are: get all your bits and pieces, all your tests done as quickly as possible. Try not to be the only thing that you think about when you're, trying to have a baby. Just, as you say, live your life. And then try to work on your physical and mental well-being, and take things like folic acid, because you could get pregnant at any time. So, and it will pass. It's not going to be forever. So, your top tips?
I think you've covered most of them. But try and stay stress-free, which I know is really difficult for everyone. But try your best to stay stress-free, and I guess educate yourself about the topic and about the tests and about the hospitals, because you might want something that we can help you with, or you might not want something. So just educate yourself about that, I think.
Thank you.
Thank you, everyone.
Take care, guys. Bye.